Hi everybody, Tim White, clinical specialist with the Aspen After Surgery Center. We're here today with Catherine, our most recent patient. Catherine has agreed to kind of talk about her experience with what she's dealt with her breast implant, more specifically capsular contracture. Catherine, thanks for being here today. We appreciate you doing this. The value of these videos is very important because right now there are women watching that have had capsular contracture, are dealing with contracture right now, are considering going into surgery to surgically fix capsular contracture. And as you have seen in thousands of our previous patients, unfortunately, surgical revision of capsular contracture is statistically very poorly set as an outcome. We work with top surgeons all over the world, surgeons who use incredible techniques, but unfortunately it's the body, your body, our own immune systems that dictate the outcome after a breast augmentation, and unfortunately that's something that you saw. So in Kathy's case, what happens is, with the surgery, the last surgery that you had, very early on after that procedure, you started to notice that your left side was high, it was firmer. You were even having some pain, correct?
Yes,
yeah.
very much.
And from memory, you actually went to the emergency room that it was such a problem. Tell us about that experience, what happened?
Well, after surgery, only my left breast started doing that. It started rising, it started getting much firmer, and it was just painful. Like, even to breathe, it became painful. So it was to a point where I couldn't take the pain anymore. I was like shallow breathing at a certain point, so I decided to go to the emergency room, and sure enough, they told me that I had encapsulation.
They had diagnosed you there.
They gave me grade 4 encapsulation.
So you can imagine something so traumatic that you'd be willing to go to an emergency room for it. And I understand you had some difficulty getting a hold of your doctor. And
yes, that was an issue.
Today. So just a brief synopsis, Catherine's left breast had become firmer. It was sitting higher. She had almost a 1.4 centimeter differential, meaning that the implant had ridden up that high because of that capsule shell. We had caught her early enough to incorporate our prevention program, which is a little different than actually treating a capsule. What it is it incorporates a medication program in combination with our treatment that actually addresses the biological biofilm or growth of bacteria that may be the cause of why you have this. And this is not something that an antibiotic alone can treat. So we caught you early enough. You have done amazingly well. One of the other issues that had occurred with Kathy is that on her incision, which was on the bottom of your areola, lots of our patients have this, in which the incision will actually dimple in. It'll pucker, almost like, my patients have mentioned, it looks like Snoopy's nose, where the nipple is pointing down and the incision is puckering. Between the treatment for the capsule, the implant being high, as well as the puckering. We just did her reassessment today. Her overall progress is 90 to 100% in different categories. Overall, if you had to, give a rating to patients on how much better you feel, you look, the softness on a 0 to 100% scale, what would you say your outcome was?
I would say honestly 100%. Like, I feel great. It looks great. It's a total improvement, 100%.
And we did your reassessment today. Your breasts are symmetrical. The incision that had puckered in is now popped out. She is being discharged today with fantastic results. So patients can expect that after they were discharged from our treatment, that there is no maintenance. Patients don't have to come back. You don't have to come back down here. And especially for you, because you came from Orlando. So for any of you who don't know, we are in beautiful South Florida here. Catherine is located 4 hours away from us and drove to us over was it a 4-week period?
Yes.
Catherine drove 4 hours for 10 sessions over a 4-week period. Which for any of our out-of-town patients, we offer a 1-week fast track, so we try not to put our patients in a difficult situation. Our fast track is 2 treatments a day for 5 days, but that didn't fit your schedule because of children and work.
Right, my job and my kids.
Correct. So you can see the amount of seriousness that capsular contracture actually is when somebody like yourself is willing to drive 4 hours 10 times over a 30-day period, but here we are. And this is typically what we see. Our research has continually shown a 90% success rate with patients like you. You've done great. You look great.
Thank you.
Congrats.
I appreciate that. I really appreciate Aspen and you guys for being so kind and willing to work with me with this. I was not like happy with my outcome, and when I came here, you guys turned it all around and made it better. So I really appreciate Aspen for doing so.
Our pleasure. Thank you for doing this testimonial, helping
no
other
problem.
women.
My pleasure.
Any issues or patients have any questions? Would it be okay if we share maybe your email or your phone number? People can call you and
can have
ask
somebody
you.
call me. Yeah, of course.
Okay, fantastic. All right, awesome. So Kathy,
Thank you so
congrats.
much. I
Thank
really
you so
appreciate
much.
you.
Good luck.
Thank you.
Okay.